Hi everyone, I am Dr. Nisha Vishnu. I am a radiation oncologist. You can find me at Max Clinic at Jayanagar 8th Block, Bangalore. At Max Clinic, we are a group of oncology specialists specializing in different aspects of cancer care, including surgical oncology, radiation oncology, medical oncology, pain and palliative medicine, and oncopsychology, working as a team so that you can have all of us available under one roof. Currently, I am also practicing as a consultant radiation oncologist at Fortis Hospital, Bannerghatta Road, Bangalore. In this video, I will take you through the basics of a super important topic everyone should know about and care about. That is cancer. What is cancer? How common is cancer in India? What causes cancer? What are the risk factors? Can we prevent cancer at all? What does cancer screening mean? And how do we treat cancer? These are some of the fundamental questions which will be answered in this video. So, the first and the most important question as to what is cancer. For that, I will take you back to your biology classes. I'm sure you all know that your body is a conglomeration of cells. A cell is the basic unit of an organism, and we are made up of different kinds of cells. For example, stomach is made up of special cells which can secrete gastric juice and help in digestion. Our brain consists of cells which are able to store memories, transmit electrical impulses, which becomes the underlying reason for everything that we do or are able to do. Kidneys are built up of different cells which help in throwing out the waste materials out of the body. So, our body is pretty much like a self sufficient universe or community in itself, wherein different beings have different function, all working towards the main function of happy sustenance. Pretty much like we have doctors as well as engineers, as well as vendors and restaurateurs, and all kinds of different people all working for the sustenance of each other and the community as a whole. And at some point of time, we all will die so that our place can be taken over by our next generations. Even cells in our body are born, they do their assigned duty, and at a designated time they become old and they die. Now imagine, what if a few of us in Bangalore gets a boon or something that we would forever stay young and would live forever, and that our kids also would live forever. Pretty soon we will have a community of immortals who would be competing for space, food and resources. If this feels like a sci-fi movie, this is what happens in a cancer patient's body. The cells that once knew what to do and when to die loses the ability to die and divide uncontrollably to make newer immortal cells. This is how a tumor or cancer is formed. And hence, the textbook definition of cancer says that it is nothing but a group of cells that loses their ability to die and divide uncontrollably, thereby evading the nearby structures and can spread to far off organs. If the cancer arises out of the breast cells, we call it as a breast cancer. If it arises from stomach cells, we call it as a stomach cancer, and so on. How does this immortality happen in the first place? Every cell carries genetic material or DNA in it. The very information of what, when, and how to do things is stored in the DNA of each cells. It is kind of a blueprint of everything that a cell has to do from its birth to death. When something internal or external comes and causes a damage to this DNA, we call it as mutation. Some of these mutations causes cancer, and the thing that causes this mutation is known as a carcinogen. Can you guess the most famous carcinogen? Tobacco, of course. either taken in the form of cigarettes or bidi or pan masalas. So, what happens when you smoke? The carcinogenic chemicals in the smoke gets into the lung cells, causes mutation or damage of the DNA. It may not lead to cancer immediately. Why? Because most of us are blessed with a robust DNA repair mechanism. But when someone smokes repeatedly, then the accumulated damage becomes too much compared to the possible repair. And that is when the process of cancer starts. That's why, if you are a smoker, today is the day you should quit. Now, how robust is someone's repair mechanism? No one can tell. That's why we all know a lucky old grandpa in our family who smoked for 50 years and never got cancer. I may be oversimplifying the genesis of cancer, and the actual mechanism is way too complex and way too multifactorial and multi stepped. But if you understand this, whatever I said, you might be able to stay away from a lot of carcinogens. What are the most common carcinogens or cancer causing agent? Tobacco, either in the form of smoking or chewing, excessive alcohol, unhealthy diet, lack of exercise and thereby obesity. Some viruses like HPV or human papilloma viruses or HBV, that is hepatitis B virus, most commonly transmitted sexually, exposure to radiation or chemicals either at your occupation or through what you breathe, as in pollution, or through what you eat, that is the pesticides and insecticides in your food, heredity, prescription drugs, hormonal therapies, all these can act as risk factors. To be very honest, only 20% of the time we are able to tell what exactly has caused your cancer until there is a direct correlator like smoking causing lung cancer. Most of the time, the genesis of cancer is multifactorial and complex with a lot of minute things aggregating to a major event. Cancer has made a major impact on the societies across the world. It is the second leading cause of death globally, with over 9.6 million deaths per year attributed to cancer. Globally, about 1 in 6 deaths are due to cancer. Cancer deaths are supposedly more in the low and middle income countries. 1 in 9 Indians will develop cancer during their lifetime. So, how is our country different from our Western counterparts? Because of lack of awareness, less screening, and because of gender disparities and social stigmas, 60% of patients who come to us are in a locally advanced stage. So it's not because of lack of better doctors or better infrastructure, but it is because of the sheer number of patients coming to us in an advanced stage that our statistics show poorer results. Most common cancers in our country are lung cancers, breast cancers, oral cancers, cervical cancers, and gastrointestinal cancers. In most of these cancers, there are some things that are in our control and there are some things that are not. For example, breast cancer may partly be attributed to prolonged exposure to estrogen hormone. Now, being a female, you do have estrogen. And if you are someone with an early menarche, that is early onset of menstruation or late menopause, you will have a prolonged exposure to estrogen and hence a little more risk towards having breast cancer. But can we control the fact that we are females or the time of the menarche or the time for the menopause? No, right? All males have prostate glands, and after the age of 80, the risk of prostate cancer is high due to age itself. Can we control getting old? Of course not. So, cancer is a disease of wear and tear, and as we all age, the chances of wear and tear increases, and hence the chances of having cancer. But good news is that there are a lot many risk factors which we know and hence we can do something about it. That is number 1, quitting tobacco and alcohol, eating a more balanced diet, a healthy diet, avoiding sedentary lifestyle, etc. If you are a lady, you can reduce your chances of having breast cancer by breastfeeding your baby for at least a year. Vitamin D deficiency is very prevalent and can be a small contributor towards cancer as well, as per the latest research. So, getting it corrected if deficient is important. And so is sunlight. Too less can lead to vitamin D deficiency, too much can cause skin cancers. So, we have here talked about how cancers are caused and about some things we can do to avoid cancers. I'll be talking more about cancer prevention, screening, and treatment in my next video. Thank you.